Hello, my name is Kyasia Banks. I am a senior health education associate with the Department of Public Health Education at North Carolina Central University, serving as an intern with Durham. Today, I will be presenting my presentation, Mending Minds, Bettering the Mental Health of African American College Students 18 to 25. The topics that will be addressed in this presentation are statistics, emotional barriers, physical barriers, consequences of neglecting mental health, and lastly, available community mental health resources and services. Now that we have addressed the topics that will be discussed, let's get into some statistics that I would like to share with you. Despite popular belief, African Americans and whites experience kindred rates of mental illnesses. However, African Americans are less likely than their counterparts to seek help due to stigma. Also, people between the ages of 30 and 40 are more likely to seek help than younger adults. African Americans between the ages of 18 and 24 are the least likely to accept treatment, which further highlights the importance of focusing and getting information and attention on this particular demographic group. It is also important to note that nearly 1 in 5 college students ages 18 to 25 suffer from a mental illness. There has been a long-standing strained relationship between the African American community and healthcare, which may not come as a surprise to some. However, it has trickled down into other aspects as well, such as mental health. Many have been taught to suppress emotions and feelings due to previous history or being warned to suppress due to fear of information being used against them at a later date. Some African Americans rely on a widely supported method of coping by either stigmatizing help-seeking behaviors or valuing self-reliance to get through problems. Though in some cases this can be a temporary fix to the issues at hand, it can cause further damage and turmoil in the long run. Bearing this in mind, let's shed some light on the barriers that coincide with these ideals. Emotional barriers. Cultural mistrust, fear of discrimination, fear of sharing emotions, fear of getting treatment, and fear of recognizing vulnerability. Through my research on this topic and on this demographic, I was able to identify that emotional barriers are not the only thing at play here. There are also physical barriers that hinder proper access to mental health care services on HBCU campuses. Physical barriers. For example, social stigma that is attached to mental health is strong on campuses, and campus leaders are not prioritizing mental health programs. There is also the issue of both budget and staffing for mental health services on HBCU campuses being outpaced, leading to even more unmet needs. According to a survey conducted by the Center for Collegiate Mental Health in 2015, it was found that the number of students seeking services for counseling jumped from 29.6% between the academic years of 2014 and 2015. Due to circumstances like COVID-19, these numbers are bound to steadily increase based on factors such as isolation that comes with remote learning, anxiety, and lack of social interaction, just to name a few. Consequences of ignoring mental health. Ignoring behavioral health symptoms can result in the worsening of a condition or the loss of life through suicide. In fact, in 2017, it was found that suicide was the second leading cause of death for African Americans ages 18 to 24. Some may be inclined to try to self-medicate through substance use such as alcohol, prescription medication, or other drugs. However, this is not recommended as it is a red flag that can lead to addiction later on. I would also like to provide some warning signs on what exactly to be aware of. Feeling overwhelmed, pressing feelings of sadness, hopelessness, and emptiness, trouble remembering or concentrating, trouble sleeping or sleeping too much, and extreme difficulty interacting with friends and family. Given the information I have provided thus far, I am now providing some resources that can be utilized in addition to services that can be found on your campus if you are in the Durham area. If you are under Medicaid or uninsured, some services you may find useful are Carolina Outreach Behavioral Health Urgent Care. Individuals should seek out this resource if they are feeling overwhelmed or are in need of assistance, needing medications to address mental health concerns, or are in danger of running out of mental health medication. Another one would be Lincoln Community Behavioral Health Clinic. Services offered here are psychiatric assessments and follow-up for medication monitoring for adults, adolescents, and children, psychosocial assessments and follow-up counseling for adults, and crisis assessments, along with referrals for higher levels of care if needed. Some state-funded services are securing resources for consumers. Services offered are mental health and medication management, telehealth phone and video sessions, behavioral health and substance abuse services. In this case, funding eligibility is determined on the service recipient's income. Another state-funded service source would be Freedom House. Services offered here are peer group therapy, individual and family outpatient therapy, and comprehensive clinical assessments. Some other resources would be NAMI Durham. Some services they offer are family support groups for North Durham, family support groups for South Durham, anxiety stress support groups for minorities, and NAMI Basics, which is a free 6-session online educational program. Information covered in this session are the importance of taking care of yourself, different types of mental health care professionals and available treatment options and therapies, the impact mental health conditions can have on your entire family, and much more. You can also find additional information about other services that they may offer of being available on their local website. In the fall of 2021, NAMI on campus will be making its debut to North Carolina Central University to provide support as well. Lastly, I have included a link to a free online resource as well for your review. Here are my references that were used for this presentation. This concludes the components of this informative video on mental health barriers for African American college students and available community resources and services in the Durham community. I encourage you all to take small steps to advocate for the increase of inclusion, both on your campus and with your peers, to start a necessary conversation about mental health. It is my hope that you spread this information about available resources with those in the Durham community who could utilize them as well. Thank you for taking the time to listen to this presentation.